Hey everyone, my name is Dr. Zach DeMeester. I'm a physical therapist with Pinnacle Physical Therapy in Western North Carolina. Today I'm going to be showing you guys a taping technique you can use to help manage patellofemoral pain or runner's knee. Okay. Now, in order to do this taping technique, there are a couple different things you're going to need. Really, just the leukotape. This is the most important one right here. Okay. But if you're somebody who has particularly sensitive skin, then having some coverall to put underneath the tape can be helpful too. Okay, I've gone ahead and cut a strip of this coverall for myself already. In order to do this technique, what you're going to need to be able to do first is locate your patella. Okay, so this is easiest to do with your knee straight. From there, you're going to find your kneecap. You can wiggle it around a little bit if you're trying to make it easy. Okay, and then you'll take the backs off of the coverall here, and you're going to place this over the patella, but you want to cover a bit more of the skin on the inside of the kneecap than the outside. So I'm just going to have a little bit on the outside there, but a majority of it is going to go medial to my patella there, right over the top of my kneecap. Okay, so there doesn't need to be any stretch on the coverall. The goal of this is really to protect your skin from some of the adhesives that are in the leukotape, which is what we've got right here. Okay, so from here, it's fairly simple. You're going to find a strip of leukotape that's appropriate for the size of your knee. For me, I like to use a little bit longer one because it's easy to get it over the edges of the leukotape. And I think if you get a little bit of the coverall, excuse me, and I think if you get a little bit of tape on either side of the coverall, then it tends to stick a little bit better. Okay, so we're taping for a medial glide here, and what that means is the tape's going to try to kind of pull our patella towards the inside of the knee. I'm going to start with it on the outside here. I like to do about an inch or so, anchored down without a stretch on the outside of the coverall. Okay, and then once I've got that down from there, I'm going to put some tension on the tape as I come across. And when I get to the other side, I'm going to do the same thing. I'm going to lay down an inch, nice and easy, just like that. Okay, if you see some wrinkles in your coverall, then you probably did a good job giving it a good stretch there. Okay. If this is going to be helpful for you, if you've taped well, you should notice a pretty immediate difference when you're running, when you're going up and down stairs, walking up and down a hill, things like that. Okay? Understand that this is to help manage pain, but exercise is going to need to be a cornerstone of management for this condition. Okay? This is something you can try to make that exercise a bit more tolerable.